which section of the plan will address the needs for access to healthy foods, which is needed to decrease obesity and improve health?
I think Oklahoma City has what the current administration now calling food deserts. So there are areas there that are not adequately served by grocery stores. We really need your input as to where those areas are. I think there is a standard that they're trying to establish about access. Everybody should be within 1 mile of a grocery store. Clearly that's not going to be possible in the rural areas, but certainly in the built-up areas, we would like to try and provide more availability. There are certainly areas of the city that are not adequately serviced. We are obviously the public sector, so we can't make those decisions for the private sector, but we have been fairly aggressively pursuing additional retail to particularly grocery stores in support of filling in some of those gaps. So it's a critical part of this, and there are a lot of different elements to the whole health discussion. But availability to healthy food is one of those. We just then have to make you eat it as well. So just as your parents said, you should eat your vegetables, and we need to pass that on. But there are certain things that we can do. We can control by providing availability, by increasing your ability to be able to get to a grocery store through sidewalks and easier access, those kinds of things. And then it also comes down to people's personal choice. And I know we have Marissa New here from Department of Health, and Marissa's a very active advocate for a lot of different ways to be able to improve our access to health, to a healthier lifestyle.
And let me, I guess more specifically add to that. I think part of the question was, where would this show up in the plan? In the fall, when we start stakeholder groups, the stakeholder groups are going to be grouped by the elements I went through. However, there's going to be a separate stakeholder groups for healthy issues, because we know those are cross-cutting issues that may show up in almost every element of the plan. So because we don't know exactly that answer right now, where it might show, John Lowry's here from the City County Health Department. We've already had these discussions, and we've had the opportunity to already meet with a lot of public health professionals in the area. So we know a lot of people are enthusiastic and want to be involved and have these issues addressed. So we'll kind of figure that out as we go through the process, but there is a specific stakeholder group for that. And I believe your card indicates that on the back.